Good afternoon, everybody. Happy Thursday. We're normally here on Wednesdays, but today we're here obviously on a Thursday due to the presidential election. And next week, I will also be here on Thursday in recognition of Veterans Day, which is next Wednesday. So this week, next week, Thursday, 1 o'clock, please tune in and please get the daily emails. A lot of changes right now as it relates to COVID in Rhode Island, in America, in the world. And it's important that you stay informed so you can make the best decisions for you and your family. I have always kept these briefings apolitical, and I'm going to continue to do that. Having said that, I think it would be odd if I didn't say just a word about the election, which we are in the middle of. I will just say, first of all, I'm proud of Rhode Island. We conducted, for the first time ever, a primarily mail ballot election in a historic and challenging election in the middle of a global pandemic, and we did it peacefully, effectively, and successfully. So thank you to all the people that worked hard to make that happen, and thank you to the people of Rhode Island for showing that our democracy is alive and well and we can have an effective and open election. As it relates to the outcome, I will not comment on that. I will simply say no matter what happens, I promise you that we are going to keep working every day, day in and day out, to keep you and your family safe, to deliver our children the best possible education that they can receive, and to be urgent and on top of our public health response. We have a job to do, and we're going to keep doing that. So let's begin today, as I always do, with the data, and I'd ask you please to put the dashboard up. Still not a good news story, unfortunately. Yesterday, we had almost 600 cases, 566 new cases out of about 16,000 tests for percent positive of 3.6%, and very sadly, another 8 deaths. It's very, very sad that every day we continue to get up here and we lose more Rhode Islanders, so please bear that in mind and take a moment to think of the lost loved ones in your thoughts and prayers. As you can see on the dashboard in the weekly data, all the arrows are pointing in the wrong direction. They're all pointed up. It was about a month ago that we started to see the numbers ticking up. And at that time, I asked everyone in Rhode Island to find small, concrete changes in their daily lives to keep people safe. Wearing masks more often, canceling social plans, canceling parties. And many of you have answered that call, and I want to say thank you. I've heard from you. You know, dear Governor, we were planning to have this party. We were planning to do this with our kids. We've canceled it. And so I know that's a drag. I know it's terrible to still be living that way, but I want to say thank you because it will make a difference. And I've been very clear over the past number of weeks, if we can't see the numbers take a different direction, then we would have to increase the regulations. And so on Friday, I announced a series of new restrictions. As a quick reminder, on Friday, I announced a reduction of the social gathering limit to 10 from 15 to 10. We announced a temporary 1-week closure of ice rinks and other indoor sporting facilities, a temporary prohibition on spectators at sporting events, and new visitation restrictions for hospitals and nursing homes. We also encouraged faith leaders to enable and emphasize virtual worship. And on Friday, we announced $5 million of aid to help offices enable their employees to work from home. Last Friday, I said I'd be coming back. I said that was part 1 of a 2-part announcement. And I said I'd be back today with part 2 of the announcement. I had hoped to spend the weekend talking to my fellow governors in the region so that we could have a coordinated response. That's exactly what I did, the team did. The fact of the matter is, we're not alone. We're not alone. Cases are spiking actually all over the world, certainly all over our region, and all over the country. In fact, yesterday, the United States saw its first day with more than 100,000 new cases. Having said so, Rhode Island is seeing what every place else is seeing. Our region now looks like we're in for the second wave and spike that they have been living through in the Midwest. And so I feel that our response will be that much more effective to the extent that we can coordinate in our approach with our neighbors. And so in a second, I'm going to announce new regulations, which are similar to what you're seeing Connecticut, Massachusetts, New York, New Jersey. Before I get to that, I just want to take a minute to remind everybody of the 3 core principles that I have in mind when I'm thinking about new restrictions. And I'd ask you please to put that slide up. First, we want our interventions to be as targeted as possible. In the spring, we only had blunt instruments: close all schools, close all restaurants, close everything. We don't need to do that now. We have better systems to help us to be more targeted. And so that's what I'm endeavoring to do. It's hard, to be very honest with you. This is really hard. We have widespread community spread, so it's tough to be pinpointed, but that's the goal, to do our best job at that. Secondly, top priority for me is to limit the impact on jobs and commerce. Businesses are really struggling, particularly our smallest businesses who maybe didn't get the benefit of the PPP program from the federal government, or for whatever reason haven't been able to receive the benefits of some of the stimulus, and they're literally hanging on by their fingernails. So, and of course, hospitality has been hit hardest all over the world, restaurants, hotels, etc., by this crisis. So that weighs on me as I make these decisions. So my strong desire is to never again have to close all restaurants or have a blunt instrument. That's what you're seeing in Europe right now. I don't want to get there. I don't want to be the UK or some of these other places in Europe. Here's the facts, though. We have to take our medicine. We could take our medicine now, or we could take our medicine later. If we take the medicine now, change our behavior, and rein in our social activity, the medicine's not going to be that bad and isn't going to have to last that long. If we wait, if we try to outrun the virus, we're going to take the medicine later, and it's going to be much stronger medicine. So as hard as that is to hear, I need everyone to try to internalize it. So if you don't want, again, to have broad-based lockdowns, which are going to put a lot of our friends and neighbors out of business, we have to really rein it in right now. And then finally, we need to protect the rights of students across Rhode Island to get the strongest possible education that they can. And that means as many kids in school as much as possible. We are now a couple of months into school. We know schools are not significant spreaders. In fact, we're not really seeing much difference in the prevalence of the disease with the in-school kids as with the children learning virtually. By the way, that's true all over the country and all over the globe. We know structured environments are safer, and we know children suffer if they're not in school. So we want to ensure that the changes that we are putting in place, that I am imposing, enable us to keep kids where they belong, which is in school. So with those principles guiding my decisions, today I'm announcing 7 new measures which will take effect on Sunday and which will be in effect for 2 weeks. Over those 2 weeks, we're going to be closely monitoring to see if the approach is working. Now let me say what I mean by that. We're not going to know if there's an effect on hospitalizations or cases. But what I will know is if people are changing their behavior. So if over the course of the next 2 weeks, the 7 regulations result in lower mobility, fewer crowds, better mask wearing, fewer parties, fewer people out and about, then we'll have confidence that they're going to lead to the results we need. It's behavior change and mobility that I'm going to be tracking. If we don't see changes in behavior, then very likely in a couple weeks I'll have to do even more, which I don't want to do and I don't think we should have to do. So please go ahead and put up the slide which reflects the phase 3 revised approach. Number 1, effective Sunday, a stay-at-home advisory will be in effect from 10 o'clock at night until 5 o'clock in the morning on weeknights and 10:30 to 5 a.m. on Fridays and Saturdays. So what does that mean? And how is it different from a stay-at-home order? It's an advisory. I am strongly advising you and asking you to be home in your own house, not your friends, not at a party at someone else's house, in your house by 10 o'clock at night. We're not going to be pulling cars over. We're not going to have a heavy-handed approach on enforcement if you're out after 10. Not at this stage, hopefully never. But it's a big signal to all of us. It's a wake-up call. Okay, I have to change the way I have to rein it in. I've got to be home. My kids have to be home at 10 o'clock. No more parties, no more socializing after that hour. If you have to go to work, obviously go to work. If you have to go to the grocery store, if you want to go for a walk, if you have to go to the doctor, obviously go ahead and do that after 10 or before 5. But by and large, we want everybody home in their homes with the people they live with, not with friends and extended family, by 10 o'clock every night and 10:30 Friday and Saturday. So if you're at a restaurant or a bar at that time, and it's time to leave, I'm asking you to go home. Don't take the party to your friend's house. Don't invite a few folks over after you leave for dinner. Please go home. And as always, I'm asking for voluntary compliance. Having said that, if we continue to see big parties, more than 10 people after 10 o'clock at night, we are going to continue to increase the fines or levy the fines and increase our enforcement. Second, also effective on Sunday, all restaurants, bars, gyms, and recreational facilities, such as the casino, bowling alleys, museums, and personal services must close at 10 o'clock on the weeknights and 10:30 on Friday and Saturday. Restaurants can continue to offer takeout and drive-through after 10 or 10:30. And also we're going to be reasonable about it. It doesn't mean we're going to come in with our inspectors or the police at 10:31 and shut you down, but it means you should take last call by that time. Start wrapping it up by 10 or 10:30 Friday and Saturday. Also, I want to keep pushing outdoor, outdoor, outdoor. We've put an enormous amount of time, effort, and money into the Take It Outside effort. It's way safer outdoors. Thank God we have some nice weather now. So if you're outside, it's the best place to be. The fact of the matter is, we know the more time you spend someplace, the more likely the virus is to spread. And we also know from our inspectors that the later the night goes on, the more people put their guard down. Maybe you've had more to drink, maybe you've been hanging around for a few hours, you're with people you know you like, you're having a good time. It's just human nature that's when our guard is down, we get too close to people, maybe we share food, we don't wear a mask, and that's what we have to try to cut down on or frankly eliminate. We haven't seen, thankfully, a lot of spread between parties at restaurants. And again, huge thank you to restaurants for doing what you're doing. But we have seen spread within parties when masks are off. So again, please try to keep your, go out for dinner with a couple people, not 6 or 8 people. And keep your mask on if you're not eating or drinking and when you're ordering. Third, we're lowering the capacity limit for indoor events and venues of assembly to 50% with a maximum of 125 people. This applies to houses of worship, performing arts venues, movie theaters. And again, all of this is consistent with what Massachusetts and Connecticut have recently announced. I've chosen to be a bit more lenient in terms of the time. But it's a very consistent regional approach, and we've been working for the past few days with Massachusetts and Connecticut, so we have an aligned approach in our region, which I think will make this all much more effective. We're also lowering the outdoor limit to 66% with a maximum of 150 people. And as I spoke about last week, we are continuing to see spread in the informal settings. So I would just ask anybody to please consider virtual worship in the next few weeks, if that's an option available to you by the church or synagogue or mosque or your place of assembly. I'm asking faith leaders to enable and allow and encourage virtual worship, and I'm asking folks to consider it. And certainly if you're going in person, wear your mask, follow your rules, go worship, go home. Fourth, we're reducing the limit for catered events to 25 indoors and 75 outdoors for the next 2 weeks. Also consistent with Massachusetts and Connecticut, our neighboring states. I will say this, if you already have a wedding or a very special event already planned in the next couple of weeks, we are open to giving you an exemption as long as you contact the Department of Business Regulation and we can have a conversation around how you're going to make it a safe event and have compliance with the rules that would make it safe. Fifth, we're reducing the capacity limit at big box stores and malls. Retailers with more than 30,000 square feet of space. We're going to go back to the phase 2 limit of 1 person per 150 square feet. Over the last few weeks, we have started to see crowding at these businesses, and we can only expect that crowding will increase as we head into the big shopping season. So I would like to remind these businesses to please have clearly marked spaces that allow people to be 6 feet apart, stagger folk, make them wait in line so the store is never overwhelmed with more people at any one time, and I would ask people to be patient. I will say we do hear a lot from big grocery stores, some big box type venues that folks aren't wearing masks, businesses aren't enforcing the mask wearing requirement. If you are a big retailer, any retailer, you have an affirmative obligation to go to someone who is there without a mask and ask them to put their mask on or offer them a mask. It's not enough to just put a sign up. 6, in addition to working from home when possible, I'm asking businesses to postpone or cancel non-essential work-related travel for the next couple of weeks. We are going to lead, the state is going to lead by example in this regard, and I've put a hiatus on work-related travel for state employees. 7th, we're updating our mask guidance to require masks at all times when you're with people that you don't live with. So basically, when you leave your home, including when you're working out at the gym, we need you to put your mask on, particularly if you're at a social gathering in somebody else's house or backyard who are people that you don't live with. Mask wearing rules in the workplace remain the same, but I would just say, just please use common sense. You know, I'm sure someone's saying, oh, Gov, does this mean if I go for a run, do I have to have my mask on? Listen, if you're out running in the woods and there's no one around you, maybe have your mask in your pocket. But if you're with other people, yes, you need to wear your mask. That means if you're on track running, and there's other people there, it means if you go hang out with friends in their backyard around their fire pit or go over to their house for dinner, which, by the way, I would ask you to cut down on. And if you do it, keep it limited before 10 o'clock, wear your mask, and just be really careful and safe, and always under 10. So I'm confident that these targeted interventions are going to make a difference, but it's only true if you guys take it to heart. We all have to take it to heart. Everyone's tired. Everyone's tired of the rules. I see it in my own family. We're tired, we're cranky, we're sick of it, and we want it to end. But the reality is it's still here. We can't control it. And if we take our medicine now, try a little bit harder now, wearing the masks, following these new rules, we'll be in a better place, I hope, in a month from now. And mostly, I really hope I don't have to do any more aggressive regulations as we're seeing in other parts of the country and in other parts of the world, because if we do any more than this, it's really going to start to hurt people's businesses and jobs even more than it already has. These orders will take effect on Sunday. I also want to let you know that at around noon on Sunday, you can expect to receive an alert on your phone with a reminder of these changes. I don't want you to be alarmed when that happens. I just want you to know this is a big deal. This is important. These regulations will save lives. It's a tool that I think I've only used once so far in this crisis, but I think it's necessary, and I hope it's a wake-up call and a reminder to everybody when that goes off at noon on your phone. Game on, rules are in effect. Let's get a little more serious, and let's follow these new rules, which go into effect on Sunday for 2 weeks. I want to say a special word to restaurants and bars, who I can imagine have a pit in your stomach as you listen to me. If it's any consolation, I do too, because I feel for you, but I also feel that it's necessary. You're doing everything you can, you're doing a good job, but still the virus is spreading, and truthfully, it's unavoidable whenever you have food and drink and people getting together. So today, as I announce the new restrictions, I am also announcing that we're going to be sending grants to all active Rhode Island restaurants and bars impacted by the early closure. Restaurants and bars will receive a minimum of $2,000 and a maximum of $10,000 based upon how much business they typically do. And we're also going to make this very simple, very easy, and very quick. The businesses will simply need to self-attest that they were affected by the early closure, and then you can expect to receive your grant from the Division of Taxation within 30 days. I understand that these grants of between $2,000 and $10,000 will likely not make up for the losses that you're going to incur over the next couple of weeks, but I hope it will help. We will get it out to you quickly, and I hope it's something to help you out. Again, after 10/10/30, you could continue with takeout, you could continue with drive-through, but we want to start moving. We want to do the last call and start moving folks home. Full details of that initiative are going to be made available on Monday, and they will be on the Department of Revenue's website, which is tax.ri.gov. I do want to preview that we are continuing to look at other measures, targeted measures that we can take, particularly in our high-density communities. There are certain communities, Central Falls, Pawtucket in particular, which have high rates of positivity, double digit, 10, 15% percent positivity. These are densely populated communities. They represent a disproportionate share of our cases, and we have to help these communities out. So we are working hard to figure out, is there a way we can have a pinpointed response in those communities to stabilize the situation in those communities. Finally, I want to preview that I'm going to be taking a very serious look at Thanksgiving restrictions. If you look at what happened in Canada after the Canadian Thanksgiving on October 12th, it's not a good story. And by the way, we've learned this. We learned this Memorial Day. We learned it 4th of July. It's pretty amazing the impact of one holiday, the impact that that can have if we don't follow the rules. And again, in Canada, they shattered case and hospitalization records in the weeks after their Thanksgiving. So similar to what I said last week, if you see a train coming down the tracks, we can't just sit there and do nothing. We have to be smart about it. So I'm going to be studying our options, but I'm very likely to be coming back next week with some more serious restrictions just for Thanksgiving. Okay, on to sports. Last week on Friday, when I announced a 1-week closure of indoor sports facilities, I said at that time, the reason it was only a week is we were going to use the week to work closely with leagues and with owners of ice rinks and sporting venues in order to come up with some new rules so they could reopen but do it safely. I have to give a huge thank you to Director Janet Coit, who spent the weekend and all this week so far having that dialogue, and of course to Dr. Alexander Scott and her team. This is tough stuff. It's hard work. We want them to open. They desperately need to be open. Having said that, we can see what's happening in New Hampshire, Massachusetts, and other places in these indoor arenas. So we have to be smart about it. And so that's what we have been working to figure out. Starting Monday, we're going to allow a maximum of 2 spectators for athletes under 18, so kids games. Face coverings will be required at all times for spectators and the athletes, and that includes practices and games. Face coverings, practices and games, and drills, and anytime you're together. I know that's a significant change. I know that is hard. I know that won't be popular, but I think it's the only way that we can allow for competitive sports to continue indoors while keeping people safe. Recently, we've also run into some trouble with locker rooms. Even with our individual sports, players are entering locker rooms and gathering in locker rooms without wearing masks. So we're going to be enforcing stricter controls on locker rooms where occupancy limits, cleaning protocols, and physical distancing will be required. And all sports facilities, I'm asking you to be rigorous about collecting names and contact information for contact tracing purposes. So we want you to open. We're going to go ahead and let you open, but we need a hand. We need you to help us with the contact tracing, collecting the information of folks who are there so that if there is a case or an outbreak, we can get on it quickly. I'd ask it that the sports slide please go up. It's a lot of information. I would say throughout the pandemic, interstate travel has been problematic. So also starting Monday, out-of-state travel for tournaments, sports tournaments will no longer be allowed. And we're making some changes based on risk levels. You can see in the slide that I just had them put up, we've categorized sports to high, medium, and low risk. Obviously, tennis is a very different risk than wrestling. Indoor is still different risk than outdoor. So we've attempted, again, to be pinpointed. You'll see low, moderate, and high risk. For low risk sports, we're going to continue to allow practices and games, including tournaments in Rhode Island attended by out-of-state teams. For moderate risk sports, we're going to continue to allow practices and games with in-state teams, but we're prohibiting hosting games, tournaments, and practices with out-of-state teams. And unfortunately, for the high-risk sports, we're going to have to maintain prohibition on all competition, including scrimmages, and these rules will be in effect through the end of the calendar year. I should let you know we've made these rules in concert with ice rink owners, leagues, sports leagues of all kinds. We did our best to enable play safely, and everything is designed to make it so that we don't have to do a shutdown. And I believe that this will accomplish that. Again, this is also an area where I'm coordinating with our neighboring states so that we have aligned guidance. And that is something that I expect. I expect Massachusetts and Connecticut to be coming out with very similar regulations to these this week. All aimed at the goal of making sure we don't have to stop sports altogether. So I'm asking you again for patience and cooperation, and just a constant reminder, this isn't going to last forever. There's a light at the end of the tunnel. We just have to try to get through the next couple of months. Okay, last couple of comments. Last Friday, I talked about a student party in Bristol that at that time had led to 5 positive cases. And at the end of the press conference, the number was up to 12 positive cases. Now we're up to 21 positive cases from this one teenage party, house party, and 350 people are in quarantine. 4 school districts and multiple sports teams have all been impacted by this. Their lives upended. And we are receiving information from school leaders, superintendents, principals, teachers regularly. And that information that we're receiving is informing our thinking about how large of a fine to levy. I do want to be clear, and I was asked a question about this on Friday. The information that we receive, which goes into the decision around whether to fine and how big to fine, comes either from law enforcement or, in this case, principals, superintendents, neighbors, et cetera, not from contact tracers. Contact tracers are public health professionals or people under the management of the Rhode Island Department of Health. They're not there to do enforcement, so best to be honest with them. I want to give a shout out to a young student at Bryant University who, when was first called about a party that he or she attended, didn't quite tell the truth, and then later had a good conscience and called back and said, okay, by the way, this is really how many people were there. Thank you, thank you, thank you, thank you. It allowed our contact tracers to get on it and keep a lid on it, and none of that information will be used to find somebody. So I want you to cooperate with contact tracers, be honest, be open, and just help us to get a lid on the virus so it doesn't become a super spreader. So I talked about this event last Friday, and we've talked about it a few times since then. And there's been 2 responses. Some people have said, good job, we understand. We parents have to do a better job teaching our children that they have to follow the rules because it's the right thing to do in the middle of this crisis. And we've heard from a lot of kids and actually young people saying, we're going to do our part to crack down on these parties because frankly, we want to go to school. But we've also heard from a lot of people saying, yeah, I'm just going to have my party. Actually, we've heard from some kids saying, cool, that was a super spreader. I want to be part of a bigger super spreader. So let me just tell you this. If you guys want to take that approach, having parties, kids will be kids, it's not that big of a deal, I just need you to know this. Your behavior is going to lead to another shutdown of Rhode Island's economy. So it's actually not a joke. It means people will lose their lives, people will lose their loved ones, kids won't get to go to school, they'll be locked in their rooms all day, falling behind, people will lose their jobs, businesses will go out of business. It's not a joke. Don't do it because I'm asking you to do it. As sure as I stand here, if we don't cut down on these parties, I will be back in 2 weeks with a shutdown order. And that will be brutal. And that will be because certain people decided they just had to have that party. That would be a shame. It would be wrong. It would be devastating. Today, we see on social media parties being planned intentionally. So I would just say, guys, help me out. We are at a place in this pandemic, I need a hand. And by the way, everyone's done a terrific job, but right now is a very fragile moment. So I'm hearing from some high schoolers who are saying, we are sick of distance learning. I wish our friends would stop doing this because we want to go to school. And I would just say to the young people out there, or really anyone out there, PTOs, neighborhood associations, it's a time to come together because we really can't afford another lockdown. And there's no reason to have to do that, which means right now, we really all have to narrow our social networks and cut it out with unnecessary social gatherings and not wearing masks and thinking it's cool to break the rules. Because it's really not cool, because you're hurting a lot of other people. Finally, a quick note about contact tracers. Again, another big thank you. The last 2 times I've been up here, the last 2 weeks, I've made a call for contact tracers. If you're out there, if you're out of work and you want a job, if you just want to help out with the pandemic response, if you have any customer service background or public health background, or frankly, just a willingness to learn and work hard and want to help out here, consider signing up to be a contact tracer. It's a good job, it's decent pay, and you'll be helping us. Go to health.ri.gov/COVID jobs and apply to be a case investigator. Since I made these 2 announcements, we have found and hired 225 people, or we received 225 applications. That's fantastic, thank you. And so if there's anybody else out there who wants to have a job helping the cause, health.ri.gov/COVID jobs. I'd encourage you to apply. So with that, I will turn it over to Dr. Alexander Scott, and then happy to take questions.
Thank you, Governor. Hello, everyone. Thank you for being with us today on this Thursday. Getting started with data, as the Governor shared, we have 566 new cases to report. That is evidence that we are still seeing very high case numbers. This is the 3rd time in a week that we're reporting more than 500 cases in a single day. We have 182 people currently hospitalized. 20 people are in an intensive care unit, and 11 people are on a ventilator. Like our case numbers, our hospitalization numbers are elevated. As a frame of reference, our 182 people currently hospitalized today compares to numbers in the mid-60s from early September. Our hospital capacity is still in a good place. We are not near the point now where we would need to utilize our alternate hospital site in Cranston. But as we have been saying, we watch our hospitalization numbers very closely, and we can't ignore the trends we are seeing. It is very clear that we have to make changes, all of us have to make changes now in order to avoid overwhelming our hospital system. In terms of fatalities, we sadly have 8 new COVID-19 associated fatalities to report. 2 people were in their 60s, 1 person was in their 70s, 2 people were in their 80s, and 3 people were in their 90s. Our prayers are with the loved ones of these treasured Rhode Islanders. In terms of our case investigations and what we are continuing to see, as it's important to make you aware in real time of what types of cases are coming in, the glaring trend remains to be the same. Too much mixing going on, too much socializing, too many contacts, all of that without wearing a mask and directly contributing to increased spread of coronavirus. And particularly given the fact that many people do not have symptoms, it's an invisible spread of coronavirus that we are wanting you to be aware of. Too many people are part of too many groups, especially in informal settings. That highlights those 3 I's that we've talked about: avoiding informal settings inside with inconsistent groups. People have their church group, their sports group, their work group, and other groups, all of whom they see on a regular basis and feel comfortable with, and let their guards down. We need you to know, number 1, too many groups, too many different people. We need to get smaller, stable groups. And number 2, you need to wear your mask no matter what. Anytime you're with someone you don't live with, no matter how close and familiar they seem to be, you need to wear your mask to avoid the invisible spread of coronavirus that can occur. The average case today has a little more than 5 contacts per case, close contacts that are identified. That compares to an average of 3 close contacts that we were seeing in June. I know that seems like a small increase, 3 close contacts to 5, but almost doubling the number of people exposed to every person who is positive for COVID-19 is actually very significant when we're having 500 new cases a day on some days. Again, we are seeing this increase in the average number of contacts because people are part of too many groups. And when we look at what do we need to change, that's something we want you to take the shared responsibility in doing. At bowling alleys, at restaurants, and other sites, we're not seeing spread between groups, as the governor shared. We are seeing spread within the groups. And the more groups you are in, the higher the risk. The more groups you are in, the greater the risk of you getting COVID-19 from someone within one of those groups, oftentimes without even knowing it. Again, decrease groups and wearing your mask regardless. This is the key of what's driving the announcements we're making today in terms of restrictions on bars and restaurants, recreational facilities, in terms of the stay-at-home advisory, and in terms of wearing your mask whenever you're with someone you don't live with. The other key is what the governor mentioned in our communities hardest hit, where there are more densely populated communities. There's not something different about the individuals in Central Falls or Pawtucket. It's just that there's more of a likelihood of having the spread when you have more densely populated communities and when you have people who are unable to work remotely because they are the workers on the front lines, in nursing homes, in grocery stores, in other healthcare facilities. So we need to come together to make the changes that are needed while we're contributing additional focus to those communities that are hardest hit because of the environments that are there. One other note I want to make on the stay-at-home advisory that the governor discussed is pertaining to older adults, our seniors. Older adults, as we know, unfortunately, are more vulnerable to the effects of COVID-19. While we are advising everyone to stay at home, particularly at night with this advisory, older adults should also consider limiting how often they are going out during the day as well. Really limit to those essential things you need, like doctor's appointments. But as an older adult, as a person with underlying illnesses, don't just look at it as a stay-at-home advisory from 10 p.m. until 5 a.m. Think about how you can make changes to stay at home throughout the entire day, except for those essential activities. You need to get food, you need to go to your doctor's appointments, you need to go to the pharmacy. But for those non-essential outings, please consider staying home, especially during this time when we are seeing so much spread of COVID-19. This is a time not to meet and go out for coffee and socialize or get together after your place of worship occurs or to congregate in your work setting, break room. Cutting out all of those times when people are socializing more comfortable indoors without a mask is going to be critical for us to stop the spread of coronavirus. Another message that I want to relay pertains to when people start their quarantine and isolation period. We've tried to set up systems to make people's COVID-19 test results as accessible as possible. We're continuing to advance with that, talking to other states throughout the country are all trying to look at creative ways to get you information so that you can be informed about what to do regarding your COVID-19 test results. That means you might learn of a positive test result through a laboratory portal online, or from your healthcare provider, or from a phone call. We want to make it as accessible as possible. In whatever way, if you learn that you are positive for COVID-19 based on taking the test, you should take action right away. We are going to call you from the Rhode Island Department of Health, but we want to make it so that you do not wait for RIDO to call you to start making the changes in your life. We want to make sure that everyone is equipped with understanding in advance what we're going to tell you as well, so that you can start it right away. First, you would want to and need to stay home for at least 10 days from the day you were tested if you receive a positive test result. This is because you are considered infectious for 10 days. That's how long the infection can continue on, whether or not someone actually has symptoms. By infectious, I mean you could make someone else sick with COVID-19 during that 10-day period. That's why it's most important to stay at home. That's where we use the term isolate. Do your best at home to keep your distance from those that you live with. If you can, use a separate bathroom and separate bedroom from others. Stay out of the kitchen and rooms where people in your home gather. Do your best to isolate yourselves from the other folks who are living in their home so that you can prevent spread from yourself to the other individuals that you live with. Also, if you test positive, you can start right away letting your close contacts know that you have COVID-19. One thing to note is that a close contact is someone you have been within 6 feet of for more than 15 minutes. Not everyone you know is going to be one of your close contacts, but you have a sense of who you have been around, you know who you are living with, you know who you have been close with. You can call those individuals and let them know about that test result so they can also take action into their own hands as well. There's also instructions for people you live with if you test positive for COVID-19. Those people that you live with need to make changes too. Those household contacts need to isolate from you the way I just shared. If those household contacts cannot isolate from you, they should also stay home for 10 days. If that household contact was not able to isolate from you during the 10-day period, they should then start their 14-day quarantine at the end of those 10 days. This is because across the board, the focus of quarantining for 14 days is for you to monitor yourself for symptoms for the 14 days it can take for symptoms to develop after your last exposure to someone who was capable of spreading COVID-19 to you. So when you're living in the same house and you're not able to stay separate from them, they are infectious for 10 days. After that 10-day period, then you need to quarantine for the 14. If you're able to stay separate from them, it's 14 days from whenever the last time you were exposed to that close contact at risk of spreading COVID-19 to you. So that's a scenario that's unique to people who live with someone who has tested positive for COVID-19. For the non-household close contacts, that same 14-day rule applies. You need to quarantine for the 14 days after your last exposure to the individual who has tested positive for coronavirus. You need to look back on the calendar, identify when you were last a close contact of that person who was sick, and then quarantine until 14 calendar days have passed since your contact with that person. So for example, if you were last in contact with the person 2 days ago, you need to quarantine for the next 12 days. Again, I'll note that a close contact is someone you have been within 6 feet of for more than 15 minutes. That's not going to be everyone you know, but most people only have about 5 close contacts. We want that number to get smaller as much as possible. It's important to know what I just shared is the same quarantine guidance that Rhode Island has been following throughout this entire pandemic since March. This is the CDC's quarantine guidance, and states throughout the country are using the same approach. The key is, remember that you should quarantine for the 14 days from your last exposure to someone who was infectious with COVID-19. With that, I will open it up for questions.
Does the evisceration, if you will, of former Speaker Nicholas Mattiello in this week's election represent to you a thorough repudiation by taxpayers of the decision not to bring together the state legislature and essentially do their jobs?
I don't think you can make that sweeping statement. I think for whatever reason, his constituents went another way. And you'd have to ask them.
Governor, on sports. Governor, so I heard from one of the owners of an indoor facility that you shut down. She has a business that opened in June 1st, outdoor volleyball, all right? Played through the end of October, rented a facility indoors, 6 courts. She's doing all the COVID, appropriate stuff. She has high rent, overhead. All of a sudden, it gets closed down without any notice. So my question is, you said originally for a week. Can you clarify? Are they back open or not?
They will be, yes. They will be able to be back open on Monday. And I'm going to let you say a few words, Janet. We are trying to get in touch with them to provide some remunerate grants, really, to help make up for the lost revenue that they've had this week. But that she's going to be allowed to be open on Monday.
Board Director Coit answers. So she sent me an email. She's got $11,000 a month rent. She's got utilities are $5,000 a month. Here's what she's doing. Mask wearing, temperature taking, temperatures posted for every single player on Google Docs, verbal COVID questions, written COVID questions, equipment restrictions, forced hand sanitizers. She's doing it all right? And so why do you need to shut her down instead of going in and surgically, the easy thing is just to shut everybody down instead of saying, you know what, there are a couple bad apples out there. And I know there was a specific situation you were addressing, and this is not the only facility you've heard from. Why do you need to shut them down for a week instead of going in with all the contact tracing and everything that you do to say, we're going to shut this down and figure it out with Janet Coit over the course of a week instead of doing the exact opposite? And how is the state going to make them whole?
Yeah. So I'm just looking at, so she sounds like she is okay, so I don't know this person and I'm taking you for your word, but based upon everything that you said, she ought to be able to open up on Monday doing exactly what she's been doing, which is good news. Listen, you got to make policy for, broadly. Sounds like she's a perfect actor based upon everything you've said to me. Not everybody is. Not the majority are.
Just a few.
It's been all over the map.
Facilities that have said, we're doing the right thing, and we got penalized for it.
First of all, what people say and what they do every single day is different. You also hear from as many people who say, we're just not doing it. In other words, we're not going to do it. We're not going to follow the rules. Or they say yes, and then they don't do it, in fact. And when we show up and we look around, they're not doing it. So I stand by the decision to close for 1 week. We have worked to put in place good regulations. I know losing a week of revenue is tough. I don't know if we can make them whole, but we're going to send some checks out the door.
Governor, since you're allowing those...
Do you have anything to add? Because you've been talking.
Thanks, Jim. First, I want to say that sounds like that person is the gold standard, and we've talked to a lot of people who are doing a great job. We've done tons of outreach this week, and even folks who are doing a great job feel like standards have relaxed and that they need to kind of reboot. Many facility owners have said to us, we appreciate that you're strengthening the state standards because that gives us license to say, if you're not wearing a mask, if you're not going to give me a roster, you're not going to be able to reserve time here. The governor saw that sports cases, they increased 68% of the cases were in the month of October. So as we were moving people indoors for sports, the idea that we should take stock and put stricter requirements in place was intended to make sure that we could have a smooth season. But let me say on that too, that I am working with the Department of Administration to use the Federal CARES Act funding to provide reimbursement for losses sustained in this week due to the shutdown. So hopefully that will ameliorate some of what you've addressed.
Thank you.
Governor, to understand correctly, spectators will be allowed 2 per athlete in those indoor facilities.
For kids sports, yeah.
For those indoor facilities. So does that apply to outdoor sports next week as well?
Yes, if they have a mask.
So that is a change.
Yes.
Initially, you had said that would be
Yes.
2 weeks. Okay, so people who have complained that they won't be able to see the end of their high school season.
They can go 2 player, 2 spectators per player, and you have to wear your mask.
Okay, and I know I hit on the school topic a lot. There are people who say, well, you maybe say there's not a lot of spread in schools, that it must be more than a coincidence that this rise has come after school started back up again. Any thought or numbers that kind of back that up, that for some reason it's spreading more because of that?
It's an excellent question, and as you can imagine, we're trying to get our arms around it. A lot of things have changed, right? So it's not just school. Sports have come back online. We've seen big increases in social gatherings. We've seen, just anyway, there's not one isolated thing. What I can tell you is putting the kids in virtual school is not the panacea, because we're seeing just as much spread among the kids who are in virtual school. And as the days drag on with the kids being out of school, mental illness is up, children falling behind is up, kids not logging on is up, abuse and neglect is up. So and we have 2 months of data now.
The numbers this week for the numbers in school versus at home was almost 4 cases per 4 to 1. It was about 250 cases in school, about 70 virtual. I know more kids are in school than twice as many, but the number in school is 4 times as many.
Yeah, we, thanks to a huge statewide data analytics team, we have been able to disaggregate our cases and really understand where the source of the increase is coming from. And we have seen consistently for weeks, there is community spread that has steadily increased, while K through 12, as well as other limited settings, particularly where there is structure, congregate settings, IHEs, where we've been able to control outbreaks on campuses for institutes of higher ed, have remained significantly lower in their cases, while the community spread not involving those scenarios have increased. Only now in this latter couple of weeks have we started to see a small increase in what you're referencing in both K through 12 and congregate settings. That really informs us it's more a reflection of the community spread occurring rather than being driven by congregate care or by the K through 12 setting. So it's basically our analysis of the data that shows the community spread as the primary driver, and then secondary increases can occur in those more structured settings, not the opposite.
Governor, you said your primary 7 restrictions are going to be in effect for the next 2 weeks, and then you went on to say that you may come back with more restrictions for Thanksgiving. Should we presume that this is going to continue on?
So a couple things. Almost certainly we'll be back with regulations around Thanksgiving. I don't know what they're going to be, but it's weighing on us to try to figure out what that might be. Here's the reason I'm going for 2 weeks. We're going to look and see if this makes a difference. We're going to see, is mobility going to go down in the next 2 weeks? Are fewer people showing up to places of worship? Are fewer people having parties? Is there less crowding in some of the big box retailers? If there is, then I'm likely to extend it for another couple weeks. You know, Massachusetts and Connecticut both did 30 days out of the chute. But if we're not seeing it being effective in terms of changing people's behavior, then I may have to change course.
Governor, you were saying that you saw on social media people planning parties, an apparent defiance, it seems, to what you're talking about. Are you monitoring social media to identify such cases, and are you calling these people, or what are you doing to actually prevent such parties?
If we are monitoring social media, and sometimes it's hard, right, to figure out all the details, but if and as appropriate, if we can be certain around who to call about what, we will certainly bring it to the attention of the school. And, you know, the diocese, if it's a Catholic school. And yes, call them proactively and say, it's come to our attention that your kids are thinking of doing this. Don't do it.
Are you asking kids or parents to actually call you to let you know of situations?
Absolutely. Help us out. Let us know.
Governor, unless something changes, Joe Sacacci, it would seem, is about to be the next speaker. He was part of your 2010 campaign. For people learning about him for the first time, what can you tell the people of Rhode Island about Representative Joe Sacacci?
Hardworking, honest, smart, really collaborative, and just a very solid citizen.
Could you agree, though, it seems confusing. The General Assembly didn't meet because of COVID, but now the Democrats are going to meet, I believe, at the Crown Plaza tonight to caucus for him. It leaves a lot of people wondering.
I was not aware of that.
Okay.
all the rules that I'm saying here apply. Social gatherings can't be more than 10. There have to be social distancing, and they better all keep their masks on the whole time.
Governor.
But could I alert your administration? I want to be a whistleblower. They're meeting tonight at Crown Plaza.
Yes. By the way, model good behavior.
Governor, we're hearing already from people, you compare basketball, I don't know if you played basketball or not, you played rugby. Hey, you never know. Point guard, perhaps. But you compare basketball to wrestling, okay?
Yeah.
How do you determine the risk management there? What about eating at a restaurant at 8:15 versus 11:15 p.m.? You know, how did all of this come about? What's the science behind it?
Yeah.
Who's making these decisions?
So first on the restaurants and then on the sports. First, I have to give a shout out to the Hospitality Association, who's been amazing partners. And they were the reason that I decided to do 10 and 10:30 instead of 9:30 like Massachusetts. We sat down with them. By the way, they're not happy about this, and I don't expect them to be, but they're telling us what's going on. And they're encouraging everybody in restaurants to follow the rules, which they have been doing. So I have to say thank you. Secondly, here's the thing about restaurants, about life. The longer we're together, you hang out at dinner for a half hour, it's pretty easy to follow the rules for a half hour. You hang out at dinner for 3 hours, you have a few drinks, you get tired, it gets late, you go back to somebody's house to finish the party. This is where we're getting into trouble. So I am not going to pretend that there's magic around 10:15, 10:30 versus any other time. But I do know we see problems when people hang around for too long and when they then, you know, continue the party at home. And actually we have seen, to the extent we've seen trouble in restaurants, it's always later. It has always been, just the facts have been clubs, bars, it happens after hours when people let their guard down. As to the sports, I can let the doctor answer the details. We're following, again, this is, you know, wrestling. Wrestling is a high contact sport. There's no way to do that sport safely. There just isn't. Basketball is different. It's a little less contact. So we're following CDC guidelines and coordinating with our neighbors. My thing is I want as many people to play as many sports as possible, as safely as possible. But some of them by their nature, like wrestling, is just tougher.
We saw the outbreaks though of the indoor soccer, frankly. In fact, outdoor soccer. Rhode Island Interscholastic League outdoor soccer. We had teams shut down for the season.
Really poor mastering.
So how, now after a week of these facilities being closed, what's changed going forward that it would make any sport safe? You know, wrestling's unsafe. Obviously golf and tennis are different, but for any sort of team contact sport of any level, are you saying that there's varying degrees of safety behaviors that can be applied here?
Yes, and also, Janet wants to jump in, but also, this goes back to what we were talking about. We were starting to see in some of these indoor facilities bad trends. Yeah, maybe there were a few who were perfect actors and gold standards. But we were hearing from parents and players that they were feeling uncomfortable at a lot of these indoor places. People were starting to not follow the rules. We saw Massachusetts and New Hampshire ran into big trouble. So we just said, pause, get with the industry. It's not that the sport is any less safe. It's that we needed buy-in to the new rules. We tried to use the week to get buy-in to the new, or not even the new rules, but buy-in to the rules to make sure that they would be enforced.
I'd like to just add that the categories, high risk, moderate risk, low risk, they come from both the U.S. Olympic Committee and also the National State High School Association. So those are categories that many states are using. They base them on things like sustained contact versus intermittent, shared equipment, the size of the team. So they're pretty standard. We didn't make them up, but there's modifications and things that the Interscholastic League and other people are doing to try to further reduce risk in those categories. And then lastly, I do think people are resilient and they want to play sports. So when we've talked to the ice rink owners or the indoor sports facilities, they are working with us on these and on ways to make sure they're enforced because they don't want to close. They don't want teams to quarantine. So by and large, I think they're on board for the stricter standards for locker rooms, for mask wearing, for maintaining rosters. So I think we're in a better place now than we were a week ago.
Does not hosting out-of-state teams mean no college basketball or
No,
football?
the intercollegiate sports, they're following an NCAA protocol, which requires testing 3 times a week and a number of other measures. So they are, as with most states, they're exempt from this and they're following their own rules.
Just a quick.
So like, you know.
If you would, Governor.
Yeah, I apologize. Everything we're saying here, you know, NCAA sports follow NCAA rules, professional hockey and such follow those rules. This is for like adult amateur sports and, you know, kids.
Just a quick follow-up. I asked you about testing last week, and there was a question about charge or not charge. You had said go to the portal. I heard from a gentleman, he said his wife works with somebody who tested positive, so clearly she wants to get a test. Went to the portal, but she's asymptomatic, and it kicked her out. Can't get a test, and then tried to go to the primary doctor. The doctor says you got to go to the portal. So, and it was specifically because of the asymptomatic. So do you have any magic to get her through the portal?
I shouldn't laugh because I feel for her, but I wish I had magic. That shouldn't have happened. I don't know what to tell you. I mean, thousands of people do it every day and they schedule. So get me your name and we'll help her out. But I can tell you it's functioning. People do it every day. We're testing lots of people a day. It's free. It should work. It doesn't mean it always does. It doesn't mean it's perfect. I mean, we've created all of this from whole cloth in the past few months. So there's going to be some glitches. We're trying every day to make it better, but let me know who she is and we'll make it happen.
Governor, if I could follow up on that, and the doctor may want to add on something on this as well. Asymptomatic cases, you know, we still don't really have a good sense of their prevalence. There's various estimates. And the director of the CDC just recently said that states need to develop formal programs for surveillance testing to determine asymptomatic prevalence. And the doctor said earlier today that one of the problems with social gathering is that many people who attend those gatherings are asymptomatic and they can transmit the virus to others, and they don't know, and the people to whom they're transmitting the virus don't know, and as a result, they're fooled into a sense of complacency because they're asymptomatic. So where does Rhode Island stand? And as I said, you may want to comment, the doctor may want to comment. Where does Rhode Island stand on developing a formal protocol and procedure for measuring asymptomatic prevalence in the community in a randomized, organized way, you know, not even taking into account, you know, the problems that Jim's reporting, which I've heard about too, with the portal kicking people out.
Which is frustrating to hear. You know, technology is a challenge and we'll have to do better. So 2 things, and then I'll let the doctor comment. Right now, our top priority with testing is even more symptomatic testing. Symptomatic, fast, symptoms, test, accurate, isolation, quarantine, contact tracing. At the same time, we are also, as I've said for a few weeks, ramping up asymptomatic testing. In some areas, we have a protocol which is well established that we're doing, and we're collecting the data. Nursing home employees, nursing home residents. In other areas, we need to do exactly what you said, which is refine the approach. You can't have mandatory asymptomatic testing, so we need to get as close to that as possible. And getting into, particularly like in places like Central Falls or high density places, we have to be getting to the community and doing more asymptomatic testing, making it easier and quicker, and then identifying the positives. on college campuses, we do have a good program going. You know, we have been very clear with colleges around our expectations for weekly testing. We've given them guidelines, how often we want the whole campus tested regularly. So I'd say we are, I don't know, 3/4 of the way there to having a really buttoned up asymptomatic program. She says it was not wrong.
Governor Raimondo, throughout the year that this has been ongoing, we've all read anecdotal reports about businesses, particularly in the hospitality business, anecdotally, if you will, failing to comply, refusing to comply. Notorious case of a gymnasium in New Jersey. This past week, however, the tensions ramped up a little bit nationally. Hundreds of businesses got together in Illinois under the advice of legal counsel, and despite the governor of Illinois' threats of, if you will, civil infractions, shutdowns, and even imprisonment, have decided to not comply with rules distinctly similar to what's happening in Rhode Island, citing effectively that they've been in compliance all along, that, as you pointed out, a significant part of the growth in the disease and reporting the disease has happened because of incidental interpersonal contact. How far are you willing to go in the state of Rhode Island, given this fomenting rebellion across the country against continued shutdowns? How far are you willing to take the authority of the state of Rhode Island in going after individual or collective groups of businesses?
So I think you can tell by my approach that I'm doing this reluctantly and in a measured way. The stay-at-home order is not an order, it's an advisory. The way we're going to enforce the restaurants is asking for last call at 10 and 10:30. To be brutally honest, like, if we get compliance with this, I won't do any more. So the answer to your question is we have to see if people comply. But the irony is the less people comply, the more we have to do. So it's just a balancing. It's just I don't think of it, to the answer to your question, I would like to not have to do anymore. And we'll see where we go.
Governor, back in June, you were at the Billy Taylor Playground and announced the state name change, and then question 1 did pass. What's your reaction to question 1 did pass on Tuesday?
I'm excited. I'm thrilled. I'm proud of Rhode Island. I think it's a strong statement. And, you know, obviously I was for it, and I encouraged people to vote for it, and I'm really pleased that it passed. It's a statement around the fact that Rhode Island is a place of tolerance and equity and inclusion. And I have heard from a lot of people since then, people of color, who feel good, who feel like, you know, they're proud to live in a state that did the right thing.
Last two, Anita O'Brien. Governor, in regards to restaurants, just to clarify, other than the hours, is anything else changing as far as capacity goes, indoors and outdoors?
No, just the catered events. The catered events. Restaurants, it's just the time.
And in regards to the, the Commerce Association, Federal Hill, and the other restaurant groups, have you spoken with them? Because they're, crying foul here. They're saying that this could lead to layoffs and closures. So what did they say? Did you try to come up with a compromise, or were you sort of set in stone with your approach?
I'll answer, and then I'll let the Commerce Secretary answer. We did have a lot of dialogue, and we heard them. Again, it was because of them. Massachusetts and Connecticut, I believe, went with 9:30. I decided to go a bit later. And also, that's why immediately we're putting money out the door. Starting Monday, we're going to be getting checks. Within a month, every place is going to get a check of a minimum of $2,000 and up to $10,000, depending on how much business they estimate they're going to lose for the 2 weeks of the early closure. So I'm not going to pretend that they like it or even agreed with it, but I did my best to hear from them. And as I said, the Hospitality Association's been a really good partner through it all.
Governor.
Just to elaborate upon the governor's expression, the Hospitality Association has been remarkable. These are enormously tough times. Dale Venturini and the team at the Hospitality Association have been in constant dialogue with us, expressing which policies would be most detrimental, how certain mitigation would be helpful. The governor's decision is really directly attributed to that dialogue, which is to say we're open for longer than our neighboring states. And the last call approach is more flexible. I also do want to give credit to the Federal Hill Association and to affiliated restaurants that have organized. Their dialogue has been enormously helpful and constructive too. We know this is very, very hard. I want to remind restaurants that we've seen a great number of restaurants apply for the Restore Rhode Island Small Business Grant Program. There's no employee cap. Any restaurant or caterer is eligible for that program up to $30,000. If you haven't yet applied, you're eligible for that. And you're eligible for the governor's new check in the mail program, which more details will follow on. So we encourage restaurants to do both.
Brian.
Any individual actually been fined yet for hosting a gathering that goes over the limit?
I don't think so. Correct, Josh? I think not.
I know people hear you get up here, you talk tough, knock it off at the parties. Why not do that? Again, kind of as the question about certain facilities, why not target certain people and send that message?
Yeah, sorry to interrupt. Two reasons. One, we've intentionally tried not to until now, and it's only been in the last week or two that I've said we're going to really crank up enforcement, and we are trying to do that. To the question Pat always says, there's a certain amount of due process. So we're not going to levy a fine unless we can be sure that people violated the rules. But we're going to start to do that. You know, I've been talking that we're changing the way we do business. The colonel has his team on it. We're talking to local police. I wanted to avoid it, but we're going to have to start doing it.
Governor, last question, follow-up. When do you expect, if Representative Shekarchi prevails, particularly since you have a good working relationship with him, when do you expect to sit down with him to reinstitute, to work to reinstitute our legislature, particularly House oversight?
So first, the business of the legislature, they need to get together and pick their leader. And if it is Rep. Shekarchi, then of course I will sit down and work with him. The first order of business needs to be to pass a budget. So what we have said and what the Speaker, Mattiello, and Senate President have said is they're going to come back in November to do that, and I'm going to hold them to that. So that's the first thing we have to get to work on. And whether it's Shekarchi or anyone else, we'll be getting together with them right away to say, okay, guys, let's pass a budget.
Candidates, or if you will, candidates, Liana Kazars told me this morning that if she were elected speaker somehow, that she would want to reconvene the General Assembly immediately. Do you find that would that be appropriate in your mind, that they would reconvene virtually or in person right away?
Virtually, again, the legislature, I have never and will not start now to tell them how to operate their process. If they decide they want to do that, I would encourage virtual or some other, with that. It's a hard body to get together in a way that would be safe as it relates to COVID. I mean, you know yourself, it's hundreds of people by nature getting close together. So look, I support that they haven't. I support that they've tried to follow the rules and lead by example. We do have to do a budget. We are going to have to figure out a way to reconvene. Virtual is better. And, we'll just see where it goes.
How can anybody consider a budget when things are so much in doubt at the federal level?
Yeah, that's why I've waited this long, but now we're getting to be halfway through the fiscal year, and I think we have to do our best. It will be imperfect. It could very likely change if hopefully, knock on plastic, we get a stimulus. But we have to try now. Thanks.